This is Act 2, Symphony of Hormones, and so we did last time, we actually started with menopause. Tonight, again, I started this earlier on. Please ask questions as we go along. I am going to start really with thyroid, but before I do that, and this first part will be repetition for people who are there, I would say, no matter what your symptom is, we have to look at why I have that symptom or sign. And I'm taking you through the basic things about how we approach any symptom or sign. I was with a couple of patients today, and it's the same thing while we're here. It's like, well, we don't want to just give you testosterone if that's low. We want to figure out why your testosterone is low. We don't want to just give you thyroid because we can do it. We want to figure out why your thyroid is low. So if those things are there, and I'm not saying it's wrong to give hormones. That's not my point here, because we never want to lose sight of the fact that whenever you have a sign or a symptom, it's your body's call for attention, okay? And that attention doesn't mean that you've all of a sudden, because the joke with the patient I saw, the first gentleman I saw today, it was 5 minutes in. I said, you know how easy this visit would be if I was a Western doctor? I said, boy, it sounds like you need an antidepressant. You've got Prozac deficiency disorder, and we'd be done. And I could see 10 of you in the sign. I could see 10 of you in the time that it takes me to actually, discuss what's going on with you. And that's actually the truth of it, because it was depression a part of what was going on with him? Of course it was, but he wasn't suffering from Prozac deficiency. So, and we want to make sure to people that I love Western medicine. I really do know internal medicine well, and I know it well enough to know that most of the times when you're seeing your doctor, you don't want to start with a drug. And when I say a drug, or a hormone, necessarily, there's a time and a place for everything. Don't ever hear different than that. So do we need a roadmap? And the answer is, Fred, and this is typical of why is the guy in here today? Because finally, his girlfriend convinced him to come in, right? So why has it been 4 years of the symptom that's been going on? Is it just because you're a guy? Okay. So it hasn't had a lot of evaluation. So it is good to get a guide in terms of this. So Transcend is a book that I'm recommending to a lot of people, not to disempower myself, because most of the actual information I give to people is very similar to what I found in this book. And if you ever want a book that is actually similar to what I tell people to do, this is your book, called Transcend. Okay. And Ray Kurzweil, who's brilliant. Terry Grossman, brilliant, very odd. Okay. Terry Grossman, very good authors. And Transcend stands for an acronym, as you can see. And we're going to cover each one of these things, and I want to go over what I mean by those. Okay. And we're going to cover each one. So, T, talk with your doctor. Please hear this. No lecture presentation is ever meant to replace honest communication with your physician. So, what do we get in a talk like this? Hopefully something better than you can get on the internet. Okay? All right, at the very least. And you'll have some information that may be discussed with your physician. I will challenge you with the things I do talk about. Challenge the Western medical viewpoint of things. But it's to include Western medicine. It's not to exclude it. It's not to exclude any other system of healing as well. It's to bring everybody to play well together. So, and I always like the definition of authority. One has particular interest in lives at least 100 miles away. So I'm far enough away to be an authority for you guys. Middle Path Medicine is my website. If you want good information about supplements or healing and things, that's where I recommend to go. Relaxation. Everybody knows, or maybe you guys don't know. I trained with Dr. Chopra and the whole gang at the Chopra Center for many years, been a meditation instructor since, 20 years, something like that. So stress management is one of my big things, and it is the most common reason people come to see the doctor, by far. Right? Everything is a stress-related illness. You will hear me say this. Stress causes nothing, exacerbates everything. So if you don't deal with stress, so whomever I was seeing today or any other day, if they don't deal with stress, they might be dealing with 20% of their problem, not dealing with 20% or 80% of their problem. I don't know, because I don't have a valid stressometer. Okay, please look at stress management. Stress management, I have a whole series on our website about this. The best form of stress reduction, the one you'll do. Okay, so look into whether it's TM, primordial sound meditation. I like M-wave technology. We have references for all these things. I really want to get to the thyroid things, but why am I bringing these things up? Once again, if you have thyroid is off, you got to ask, is my thyroid off because of stress-related immune system dysfunction that affected my thyroid? And if you don't deal with stress, you'll probably be playing with your hormones forever without getting the actual results you're looking for. So I promise you, this is important, Okay. Assessment. Most important things in life, the stuff you can't measure. Measure everything else you can. That's my basic philosophy. Okay. So I believe my thyroid level is good. No, that's not good enough. Belief is important for so many things, but we can measure thyroid. Okay. So I want to emphasize, when we're measuring hormones, we want to look through all of these types of things, and there's very sophisticated testing. As time goes on, we'll do more and more sophisticated testing. I'm going to talk, of course, about thyroid and adrenal specifically today. Nutrition, again, there's so many references on nutrition. We have Foundations of Health, what we recommend. We were talking earlier with someone, always start with digestive health. If you have digestive problems, that's the place to start. If I don't mention this later on, I'm going to do it right now. There is a whole subgroup of people. If you have thyroid autoantibodies, meaning antibodies versus your own thyroid, you are gluten sensitive until proven different. Okay? And it's very important to hear that most of the times, all the testing we can do will miss maybe up to 50% of gluten sensitivity, meaning your test will be normal, okay, but you'll still have gluten sensitivity anyways. So, and almost any symptom you can think of, from insomnia or whatever else, can be related to gluten sensitivity. But be very clear, if you have thyroid autoantibodies, antibodies versus your own thyroid, you're considered gluten sensitive until proven otherwise. And that's why we start, well, why would I be gluten sensitive? And then we'll have to look at the 4-hour program talks about a digestive approach to health, and let's start with that, okay? Supplements, very important. Basic nutritional things, of course, there are things that you can do for thyroid as well, and adrenals. Calorie reduction, self-explanatory. One of the main problems we have in our country, calorie excess. And you can be putting manna from heaven into your body. If you put too much, you put your digestive fiber out, and you don't digest well, digestive health goes down. Okay, so you need to hear that. Calorie reduction is important. Exercise, all levels of fitness. I cannot emphasize this enough. You can get people to exercise too low, lots of hormonal issues, just right, and you can over-exercise to the point where you drop your hormonal levels as well. And you've got to find the sweet spot. Okay, and if, we cannot emphasize enough, if you have hormonal dysfunction, including thyroid dysfunction related to lack of exercise, it's better to treat it this way. Now, why don't most doctors recommend this? Because we know that you're probably not going to do it. There's tons of studies proving that we can recommend stuff until we're blue in the face, and you won't necessarily do it. So your doctor's just going to keep throwing you drugs. And then you're going to get mad at your doctors, just throws drugs at me. You know, and so we have to be careful about, are we willing to make the changes necessary? New technologies, please look at 23andMe. It's a wonderful website for looking at genetics, okay? And if you haven't looked at, I was actually looking at some slides because I was trying to remember. Just 2 years ago, it cost $399 to get a full genetic profile from these guys. It's $99 now, okay? So you can just, from a simple spit test, get your genetic analysis between you and a private company, no insurance involved, and find out what things you're at risk for, including things like immunological profiles. Am I at risk for celiacs and gluten sensitivity? Things like that. Okay, very important things. Should you ever go on certain drugs? And it's inexpensive nowadays. Very important. There's so many other new fun technologies coming in, but we're not going to get to all that. Detoxification. Okay. Okay. So, all right. Excess smoking does exist. Okay. So we have to look for that. All right. So, detox. We'll talk about this one more time as far as things. Can you heal thyroid dysfunction just through detoxification? Yes. Okay. Every system of healing, thousands of years, transcontinentally, says detoxification, one of the most important things you can do for healing. Okay. Preventive medicine, especially, is preventive medicine. Detoxification best done preventatively? Yes, indeed. So we don't want to wait until people are really sick. So I used to have a facility called the Natural Balance Wellness Center. And I said, you know, we really aren't the wellness center. We're a natural balance disease treatment center. Because we want to be a wellness center, but nobody comes in for that. And so you have to be careful about it, even for right now. Anybody who calls themselves a wellness center is not, it's a very small market of people, because most people are not willing to invest in their own health when it means it's just how to promote wellness. Okay? Detoxification, I recommend, I think you're becoming clear about that, on a regular routine basis. What does that mean? Do some form of detoxification, whether it's doing your sauna regularly, doing some form of program, Heal Detox, Ultra Clear Renew. These are all groups of things that you can use to support your body. and do detoxification on a regular basis, a week to 2 weeks, 3 times a year. That's what I'm talking about.
What is heal detox?
Heal detox is, it stands for a homotoxicology system from Germany, but it's similar to homeopathy, and it's basically a collection of 3 different supplements that are used to help support your body detoxifying through the kidneys, lymphatic system, GI, and liver tract.
And what are the supplements?
They're homeopathics. One's called berberine homocord, one's called lymphomyosat, but those types of things. Sauna, I can go on and on, the benefits of sauna and on a regular basis. You have to be careful about body type and some other things, your sensitivity to heat, but it's a wonderful way to promote detoxification through your skin. There's a lot of people involved. Miranda is being shy in the back. The A4M Fellowship is the part of, I've been doing this for a long time before I decided to join A4M, the American Academy of Anti-Aging Medicine, because I'm not anti-aging, for aging healthily, but you have to be careful about how we define aging. And so there's a lot of people, a lot of slides, a lot of people involved, Pam Smith, Eldred Taylor. So some of the slides we're using are courtesy of people and me doing these fellowships, so I can use their slides as well too. Questions about Transcend, that program. Okay, so once again, no matter what your symptom, ask yourself and start with, and have a category of things. I mean, within the ask part where I had supplements, Transcend, SEND, please actually put into there, that's not S for supplements, but am I doing a sleep evaluation? That's a very important thing to put into there as well too. So supplements and sleep, and we can throw that into stress reduction, but sleep is such an important part of that as well. So am I evaluating my sleep pattern? You cannot be healthy if you don't sleep adequately. The endocrine, the symphony of hormones, from the pineal, the pituitary, thyroid, thymus, pancreas is a huge part of that, and we aren't even going to talk about that today, but how your pancreas, and through insulin levels, interacts with the rest of the hormones in your system. And it's amazing how these are involved. And you have to be careful. This thyroid doesn't work on its own. It does work in conjunction with other things. And that, if you've heard me talk before, it's really about, especially for women, ovaries, men, testicles, obviously, and interacting with the thyroid, which interacts with the adrenals. The adrenals sit on top of the kidneys. They're adrenals on kidneys. That's how you know about them. And so that's where they're located. So